The broadcast is now starting. All attendees are in listen-only mode.
So is Chad starting this, I thought?
Yes, I will start. I'm watching the number of attendees scroll up, so welcome to those who can hear me. We'll wait just 1 minute and let anybody who's still logging on get joined. We do have some time constraints, so we want to make sure we're mindful of everybody's time and we get started as close to right on time as possible. All right, well, let's go ahead and get started. I'm sure hopefully we'll get some even more people to join as we get started. But I want to welcome everybody today. I know it's been a while since we've had one of these ambassador webinars, but I think we're starting back up with a really great presentation this week. We're really honored to have two great people who have done a lot of work with exercise medicine with us today. So the first is Katie Schmitz. She is a professor at Penn State College of Medicine. She is also the current president of ACSM. And then we have Robyn Stuhr, who is the vice president of exercises medicine. She joined the EIM team in 2017. These two have done a lot of work in the last 2 years to really build on what has been done to build up EIM into what it is now, and their work has really focused on making sure that EIM continues and can continue to grow and be productive as an initiative. So we're really excited to hear about all the work that they've been doing. Just a housekeeping note, we'll have some time for questions at the end. You can use the control panel that should be on the right-hand side of your screen to type in any questions, and we will share those with our presenters at the end of the presentation. So with that, I will turn it over to Katie.
Okay, hello everyone. Thank you very much for joining us today. We're going to jump right in here to our presentation. I'm going to apologize at the start that I don't get to stay for the entirety of the presentation because there was a mix-up of time change, and I'm actually in another meeting. I'm in Chicago right now. So I'll lead us off, and then you will be in the capable hands of Robyn Stuhr. So next slide. I think Robyn is the one who is moving slides. Is that correct?
Yes, that's correct.
Okay, there we go. So the first thing to remind everyone of is what the vision is for exercises medicine. This is the kind of thing that is potentially a throwaway when you sort of think about it like, yes, we all know what it is. But when you're out there and talking to people about exercises medicine, there's value in understanding what the stated mission is so that we can all say the exact same words and so that we can all be on the same page as we move forward to try to change the world so that every patient at every encounter has exercise assessment and advice and referral. So the vision of EIM is that EIM will make physical activity assessment and promotion a standard in clinical care at every visit, connecting healthcare with evidence-based physical activity resources for people everywhere and of all abilities. Next slide. Next slide. Can somebody go to the next slide? I don't think I can. Hello? Can someone go to the next slide?
Katie, it looks like the next slide is up on our view.
Oh dear, I'm not seeing it. Huh. I don't know what to do. Ah, okay. I don't know what happened, but now I have a new view of things. It says linking healthcare and health and fitness. Is that what you all see?
Yes, that's correct.
Yeah. Great. If you can back out of the thing that says EIM solution, that might be really helpful. Thank you. Okay. So you can see the two arrows coming together. We're trying to bring together healthcare and health and fitness. Step one being that in healthcare, there is a physical activity assessment. Okay, so PAVS, physical activity is a vital sign. And step one in health and fitness is the health and fitness workforce development on EIM on campus, EIM, credentialing. Step two, bringing them closer together, is that the healthcare provider is providing advice on physical activity to start, increase, maintain, or modify their activity. And in the health and fitness world, step two, bringing things closer together, is the health and fitness education and certification, that EIM credential. So now we're aligning things even more closely. Step three within the healthcare world is the physical activity prescription. In the health and fitness world is health and fitness employment, working in medical fitness, working in commercial fitness facilities, personal training, community fitness, health coaching, well fitness. And then in healthcare, the fourth step is the physical activity referral, where it's not just a matter of saying, hey, throw away, you should be exercising, but where should you be exercising? With whom should you be exercising? Making sure that the person understands the who, what, when, where, how of getting that exercise to happen. So that taken together, now you can do that next. Push the button one time, and you'll see that it will say EIM solution. I don't know if it says it on your screen, but it does not say it on mine. Eventually, there we go, the EIM solution becomes a framework for implementation of exercise medicine within healthcare. Next slide. So we are really trying to leverage our strengths in ACSM, bringing it together with exercise medicine to leverage our strengths as a membership organization by focusing on educating people so that they understand, educating our members so they understand how to interact in the healthcare setting, doing implementation science research so that we can move the research forward to show that doing physical activity is a vital sign, and referrals from healthcare professionals actually do work in improving the health and decreasing healthcare costs of patients. Also looking at education of clinicians, sports medicine, primary care, PM&R, etc. Also developing the workforce so that students in kinesiology, in heading towards physical therapy, in any undergraduate or graduate program become more and more aware of the exercise medicine solution, and we can all be on the same page about how it could work, as well as making sure that certified health professionals are aware of the opportunity to learn to work with healthcare professionals in order to get referrals into their business. So key approaches to EIM that involve members' expertise are absolutely in our wheelhouse. What is outside the wheelhouse is changing the healthcare system. But we are willing to try. We want to trial. It is absolutely achievable with the right partners. And the proof is in the pudding. There are 3 healthcare systems across the United States that are already doing this and doing it well, and are showing that it is improving the health of their patients. One is in South Carolina, one is Intermountain Health in Utah, where Liz Joy is, and one is Kaiser Permanente Oakland, or Kaiser Permanente overall, where Bob Salas is. Next slide. There we go. So EIM is governed by a number of different individuals who are all a part of our governance board. This is the deciding committee for all activities related to exercise medicine. So I am the current president of ACSM. The president-elect is Bill Kraus. The ACSM past president, who serves as the chair of this governance board, is currently Walt Thompson. As of June 1, it will become me. And the chair of the advisory board is Bob Salas. He's also on this. And then we have at-large representatives from the clinic, which is Liz Joy, from fitness. Right now that's Tara Ballard, and from science. And right now that's Mike Pratt. Next slide. The governance board, as I said, is a standing committee within all of the 67 committees of the American College of Sports Medicine. And then there are subcommittees from around EIM that roll up to the governance board, given the fact that the expertise that is needed for a subcommittee that is going to help us to change clinical practice and change the workforce of physicians so that they understand how to use physical activity as a vital sign is in clinical practice. Whereas if we want to try to talk to community fitness facilities that are not for profit and help them to understand to receive physical activity as a vital sign and referrals from healthcare, then we need a different set of expertise, and that's on the Community Outreach Committee. So you can see that there are a total of 7 committees, and then historically, the EIM Advisory Committee was the governance board, but it wasn't actually a standing committee. And so a couple of years ago, we formed a standing committee that is like all of the other ACSM committees in terms of how things roll up to the board and decision making, called the governance board. Next slide. So exciting. So I am delighted to tell all 28 of you on the line now that we have that is going to occur at the annual meeting, and it is our one midday session this year at the annual meeting called "Exercise is Her Moving Medicine." It is on Wednesday, May 29th, from 11:45 to 12:45, and Keegan Randall, who is an Olympic gold medalist in cross-country skiing, who is also a cancer survivor and a mom. Those two things are important because she managed to continue training for the Olympics while she was pregnant, and 2 months after she won a gold medal, she discovered that she had been diagnosed with an aggressive breast cancer. So she's going to come be our speaker and be on the stage and have a conversation with us, along with the director of the UK version of Exercise is Medicine, which is called Moving Medicine. So Natasha Jones will join us. And then the other person who will be on the stage with us, of course, is Bob Salas. So I'll be moderating a conversation between Natasha, Bob, and Keegan in order for us to really get a good sense of, from somebody who's really done it at a very high level, what it means to be pregnant and exercising at a very high level, receiving cancer treatment and exercising at a very high level, and what kind of advice she might have based on her experience of dealing with her clinicians, knowing that she wanted to be active. Were they open to those ideas, and what kind of changes could we make to the healthcare system so that those who have chronic conditions and or even acute conditions get the proper exercise referrals? So this is our way of trying to highlight exercise as medicine at the annual meeting and bring in somebody who is just a wicked cool character. If you have not, I invite you to go ahead and navigate after this webinar over to YouTube and type in Keegan Randall cancer and see a little YouTube video of her pre-chemo workout, which is harder than any workout I've ever done in my life. So that's that. Next slide. Okay, so I believe this is either the last or next to last slide that I'm going to be doing. So just to remind everyone, there is brand new messaging that is out from the new federal-wide guidelines for physical activity for all Americans. One of the things that is a big change in this year's guidelines that is very relevant to the exercise as medicine movement is that every minute counts. So we've done away with the bouts. We're no longer telling people you can do your exercise in 10-minute bouts 3 times a day. We're telling men and women in America every single minute that you are off the couch counts. I feel like I should stand up right now. Anyway, the nice thing, and I love this sentence, the day is a treasure hunt to find opportunities to move. snack mentality is the way to go for physical activity. There's some beautiful new research from Marty Gabala about exercise snacks, the idea of taking a minute, 2 minutes out of the day and doing something vigorous and then coming back to your desk. So then why has a big influence on your motivation and engagement. Why are you doing your exercise? We just are fresh out of coming from the ACSM Summit, and the theme of the summit is do what you love. Do what you love. It wasn't the stated theme before we got into the summit, but it just so happened that the first keynote speaker went there, and so did most of the other keynote speakers. Doing what you love, being active for enjoyment, fun, and pleasure, and doing something that you can do that feels good while you're doing it will keep you active longer than adhering to something that, you know, feels like you're doing the guidelines but you're not having any fun. Your health reasons for participating in physical activity are, of course, important. Of course, important. But the thinking now is to make that secondary. That, in fact, those outcomes are probably too remote for people to make decisions right now to get up off their chair and move. And so finding what you love and getting people moving with what they love is what we're now recommending. Next slide. Did it go? I don't see the next one.
The next slide is there.
Okay, I'm not seeing it. I think that was my last slide, Robyn. Is that correct?
Close. There's one more slide about messaging guidelines, and then I'm on.
I don't see it, so I'm going to hand that off to you. Okay?
Okay.
All right. So I'm going to say thank you all very much for listening, and I'm sorry I can't stay for the rest of the time because I've got a conflict. But it's wonderful to be with you all, and I'll talk to everybody soon. Thank you. Bye-bye.
Thank you, Katie.
Yep.
Thanks, Katie.
Bye.
So this is Robyn. So I'll just finish up that some of that new messaging, as Katie mentioned, we think is so important for Exercises Medicine, our target, because these are people that have not previously often been successful, and it's about giving people choices so that they can feel in charge through physical activity. And many of these folks that may have had a previous negative experience with activity. So this is about, you know, not having activity be seen as a punishment, but as a gift. As Katie kind of referred to, avoiding this all or none mentality, but focusing on do what you love, get it in however you can, because it does all count. So I wanted to move on to, geez, we're just having a little technical difficulty in moving my slides forward. And while I'm figuring that out, I'm just going to share that since I've been here the last year and a half, one of the things we've been doing is just reviewing all of the resources at Exercises Medicine and taking a look at what we can do to update those, make sure they're aligned with the most recent guidelines, and so that's what we've been doing, and that's part of what I'd like to share with you about where we've been making progress. Okay, good. All right, so we have been, the whole ACSM leadership has been engaged in something called continuous improvement science, and this is a new, it's a form of a management operating system that the whole college is going to be using to guide their efforts and to make sure that we know where we're going, why we're going there, how we can involve members in advancing strategic initiatives that we have decided are important. And the Exercises Medicine team was actually an initial team that started piloting this management operating system based on continuous improvement science. And it's basically, you set your goals, but you're always reviewing what you're doing. You're assessing, am I successful? And we've been developing, we've been clarifying, what are our fundamentals? I'm going to share those in a minute. And what does it look like to be successful in each of those fundamental areas that are critical to EIM? and what are the key performance indicators that are going to tell us that we are moving forward successfully. So I wanted to share with you a little bit about where we decided to start this year, because here at the National Center we've got 2 staff that are dedicated to EIM, and we've got a remote staff that provides some part-time assistance. So we have to be very thoughtful about how we utilize our resources, and also how we reach out to all of you to be engaged. And whoops, let me go back. I guess I won't say, hold on, how can I go back? All right, so of the fundamentals, there are basically 7 fundamental areas that are involved with EIM. And I'm going to just share those with you, and then 6 strategic initiatives that we are working on with those committees Katie talked about. The fundamental areas of exercises medicine include healthcare provider engagement and education. You'll see that's the top one here on these strategic initiatives. Exercise professional preparation and education. Both of those are critical to both sides of the equation. Then ACSM member engagement and support of EIM. We need to do a better job of letting people know what EIM is and inviting them into play a role in some of the initiatives that might align with their interests and expertise. A 4th area is connecting healthcare with physical activity resources, and that's the exercises medicine solution that I know many of you learned about through your training with EIM, and trying to work to help to establish those partnerships between healthcare associations and community fitness resources. The 5th fundamental is healthcare system payer support and policy and advocacy, because as we all know, if you don't get reimbursed for doing it in healthcare, you're less likely to do it. And if it's not something that is required to be done in terms of a quality measure or some kind of safety standard, then it may slip through the cracks. And physical activity has not been systematically reimbursed, and that's a big area in which we don't have as much say, because there are many other players and stakeholders, but we want to have a seat at the table. So that is one of the things that we want to engage in. Then exercises medicine research and bidirectional learning, as well as our EIM global network. And so for this year, we decided that we would start with 6 strategic initiatives. And the first 2 have to do with healthcare provider education and engagement. So the first is we want to provide resources for healthcare providers of all stripes, not just physicians, but nurse practitioners, physician assistants, physical therapists, that are up to date, relevant, and easy to use. And I'll share with you a little bit about where we've been going. And then we want to accelerate the advancement of exercises medicine by partnering with healthcare professional associations. And we've begun that process. And one of the reasons we feel this is so important is because we have healthcare providers that are members of the college, but for many healthcare providers, we are not their primary membership association. So if you're a family practice physician, you are a member of AAFP, or if you are a physical therapist, you are a member of APTA, or if you are a nurse practitioner, you're a member of the American Association of Nurse Practitioners. And we need to get to those healthcare professionals because they're on the front line of seeing patients, particularly in primary care settings, where they have a chance to deliver this message and implement EIM. And so we want to utilize partnerships with those associations to leverage their ability to speak to their members and get and do some collaborative work on policy as well as the promotion of EIM. Then our third strategic initiative for the year is exercise professional education and preparation. So again, like healthcare providers, we want to provide resources that are up to date, relevant, and easy to use. We've got 2 strategic initiatives in the EIM Global Network category. And the first is we want to increase the number of countries that are involved with EIM. I'll talk more about the global network in a bit. The foundation and scope of work that is being done in those countries. And then the second one is we want to enhance the value for those countries of being associated with the EIM Global Network. So to prove our ability to share resources, provide support, help people connect with each other, and we're doing some work in that area too. And then the last one that we're working on this year is ACSM member and engagement and support, and that's specifically on the EIM on Campus program, which is designed to promote and spread EIM on campuses, to improve campus health, as well as to educate professionals of tomorrow, both exercise professionals as well as healthcare professionals, so that they can spread the word about EIM. So we've been working on key projects regarding building out our resources, and you may, if you visited the EIM website, you may have noticed that there are a number of changes in content on the website, the navigation, the images. We've been doing a lot of work to make it easier to use and to make the content up to date and more helpful. We also refreshed the EIM logo. So you may notice the logo is bolder, simpler. We've removed some of the extra parentheses and things that surround it. This is kind of in line with what is happening with other logos in terms of understanding how they can more powerfully communicate the message. And so we're using new EIM logo, and we're in the process of building new EIM slide decks that we can share for healthcare provider association or healthcare provider presentations, as well as for presentations to exercise professional. So that's something by the end of the year we hope to have decks that we can share with those who are doing talks on behalf of EIM. So wanted to share with you a little bit about the resources we have been creating. Had to do that corny thing. So exercise professional, if you go on the website, we've created a whole new exercise professional action guide that gives a very comprehensive look at how you, as an individual exercise professional, can be part of this initiative. And as part of that guide, we've also updated all of the forms that were associated with the previous guide that was in place, using ACSM's newest exercise guide prescription and guidelines, and also designing some updated forms that can help you communicate with the healthcare provider. So patient progress reports, as well as initial assessment reports, that if you are working with a patient that has been referred to you from a healthcare provider, you have a professional form that you can use to send back or to communicate as to how the patient is doing on their plan, and any questions that you might have for the healthcare provider. So go to the website if you're interested in this and take a look, because it's a great resource for exercise professionals, and these are now online. In addition, we have the Clinical Practice Committee has been working on updating our healthcare provider resources. So we just last month updated our healthcare provider action guide, again, full of very good information about how to make this work. Starting from that physical activity vital sign to a couple of different options for a physical activity prescription form. We updated a community physical activity resources that can be customized for each practice by someone in the practice who's tasked with identifying what facilities are in the region that are convenient for patients, identifying programs in the community. Maybe there are Silver Sneakers programs or Arthritis Foundation programs that can be offered to patients, or partnerships with fitness facilities or exercise professionals that have established a relationship. So we have that's included. We have a coding and billing tip sheet for providers so that they can be more incentivized to take some time to counsel patients about physical activity and potentially get some increased reimbursement for doing that. We have a summary sheet for talking about the exercise as medicine solution, And then we've started working on a whole series of patient handouts. And hopefully by annual meeting, we will have about 25 completed, and there will be at least 30 or more that we do. And I'm going to show you a little bit of an example about that in a second. But our goal with these handouts was to update them so that they could be handed out by a healthcare provider or an exercise professionals to support a recommendation to be more physically active. And we have foundational handouts as well as disease-specific handouts. And the first several of these are now online. So right now, the foundational handouts we have online is something called Sit Less, Move More, and we feel like that should be given to every single patient or client because it really supports the new national physical activity recommendations for people to just reduce sedentary activity and find every minute they can over the course of the day. So it's a great, easy-to-read handout. And then we have three additional ones we're going to do, but the foundational one is Being Active for a Better Life. It's just for a sedentary patient. The Older Adult Committee has been working on a handout, Being Active as we get older, and the Pediatric Committee is working on being active as a kid and a teen. So those two handouts hopefully will be up by annual meeting. And we're writing these all at a 6th to 8th grade reading level. We're using a larger font than has previously been used, and we're using infographics to make it more compelling and easy for a patient to read from a variety of educational levels. And then we're putting together disease-specific handouts. Some have already have previously been on the website, and we're updating those with our new look and feel as well as with updated information. And others are new topics that we're adding at the request of the healthcare provider or the clinical practice committee, who says these are the things that come through our doors, and these are the types of patients we see where we'd like to provide some advice to be more physically active. So these are just a few of the topics that we are going to be putting up on the website, and I invite you to go to the Prescription for Health series webpage and check them out for yourself. So this is an example of the front page of the Sit Less, Move More handout. It's just one page front to back, inviting people to pick things that they can do that will work for their lives. And on the right, you'll see the front page of Being Active for a Better Life. That's also just a 2-page handout. And we also created these so they could be scanned into the electronic health record and given to the patient in the after visit summary that they will often get, to summarize the doctor's recommendations and highlight any key medical issues that were identified during the visit. So these will look good and scan well into the electronic health record. I just wanted to share with you a little bit about something we've been working on. This is a website that we have started working on. We had some initial financial support to do this, and this is a public-facing website that we hope to build out. And it's again, this was built at the request of the clinical practice committee, who said, sometimes I just, someone can't pay for a personal trainer, or they don't have access to a fitness facility, and we'd like to send them somewhere where they can get some ideas about how they can become more physically active. So using the behavioral theory of the trans-theoretical model of behavior change, there you go, I got it, and working with the behavioral SHI group, which has several psychologists that do work in behavior change, we developed a little pathway so that when people come on, they can select where they are. Are they ready to exercise? Maybe they're thinking about it, they're active, but they don't stick with it. And they go through an activity that is specific to being in that stage of change. They do a quick screening, and then they'll be directed to some resources that are appropriate for where they are and where their goals are. And this is not, it is actually live on the internet, but we're not promoting it because we have a lot of work to do in terms of adding content. And I'll be asking ACSM members to help us to contribute to that, and we're going to actually be asking for some resources because we really would like to continue to build it out in a very slick and updated way. So just to share with you, that's on the horizon, and this is the URL, myjourney.exercisesmedicine.org, because being active is a journey for all of us. Sometimes we're great, sometimes we're not so great, but the point is that we want, obviously, everyone to be active for their whole life and find a way that works for them. And I wanted to give you an update on the EIM credential. So that was a program that was established a few years ago, and we've been working with the EIM Credential Committee, and we've approved some new requirements and a new structure that will be activated by 2020. I can't share that specifically, but we went out to this last year. We did a lot of focus groups and surveys of individuals who both healthcare providers, did focus groups with healthcare providers as to what they're looking for in an exercise professional in the community that they could trust. And then we also went out to exercise professionals to find out a little bit about what they needed in order to feel confident in working with a referred patient. So those requirements and structure, we're trying to make it simpler, clearer, but have an assurance that for healthcare providers that those individuals who have the EIM credential are really someone that they want to refer their patient to. And then our hope is that we've been, if you've been looking at ACSM's website, you may, or you've done any online education with ACSM, you may have noticed we have a new online learning management system, a new online platform where we can deliver courses, and that's where the EIM course sits. We are this year going to be updating that course again to align with new guidelines and building out the composition of the course itself to include some new information. And we're also going to be leveraging this new technology, and we're hiring a consultant in educational design and understanding how we learn and have a more interactive and engaging course experience than we've had previously, so that we will not only have good content, but it'll also be more fun to be part of, and it will also be easier to remember what it was that you learned online. So we're going to be starting, hopefully, work on that, and we're going to be reaching out for subject matter experts. We'll do that through our committees and potentially in some other ways. Subject matter experts that would want to contribute to updating the various sections on common chronic diseases, healthcare essentials, group medical fitness, and behavioral support. So we don't want what is happening on the right. We want our exercise professionals to be professional and to motivate their clients with safe and effective training programs. So the EIM online course currently has a focus on 3 areas. The new course will have more information about working as an extended member of the healthcare system. And not only will we talk about the exercises medicine solution, the comprehensive approach to integrating EIM into a healthcare system and connecting with community partners, but we're also going to make sure people understand how individually to work with healthcare providers, understanding HIPAA, understanding documentation, understanding communication pathways, and some terminology that will be helpful, so you will be, so you can act as a member of that continuum of care. As I mentioned, we are going to be expanding the section on working with patients with chronic disease. We're going to be adding some sections to request as requested on pre-diabetes, on working with patients that have low back pain, and also working with patients that are aging, whether or not they have any specific medical condition that they're dealing with. The aging body is a different body to train than a 20 or a 30-year-old body. So, we had in some of our focus groups from exercise professionals, we had requests to include working with that particular group as well. And there are some other areas that we're going to be adding to this. Then we're going to be working with our partner. ACSM has a partner with Well Coaches that has been doing coaching and certification in health and wellness coaches for a long time. They're now focusing on training programs to help individuals prepare for the new International Consortium of Health and Fitness or Health and Wellness Coaches certification that is aligned with the National Board of Medical Examiners. In any event, that's a large certification that could be obtained if you wanted to go and become a health and wellness coach. But this information is really important for exercise professionals so that we're really successful with our clients and patients, and we know how to engage them and motivate them and bring out the best in them, not what we want for them, but what they want for themselves. We help them find that, and we help them be successful. And then the last we're adding is facilitating small group fitness interventions, because medical systems are starting to move to the population health model of care, and in that model, they're identifying individuals that have a common chronic disease and may benefit from a fitness intervention, but it's more cost effective if you can to have small groups, and it also leverages the social support that you can have within a group setting. So we're going to be adding a section on how to work in small group settings with those that may have some chronic medical conditions. I just want to share a little update about our global network. So we currently, Mark Stoutenberg, who was previously working with many of these countries, is now coordinating the global network for us. And we currently have 32 countries that have signed memorandums of understanding with us. That doesn't include the US of A. And we have a couple of other countries that are in conversations with us now. We're very excited about what's happening with the global network. And because every country is unique, the healthcare systems are unique. There are many countries that have socialized medicine. They may have different academic settings. The government support of being physically active, and that infrastructure is different, and then just the different cultures in various countries. We can't go over there and say, we wouldn't want to say this is what you do, but we're sharing these principles with each country, and they're developing plans based on their unique environment, how to activate EIM with providers, with exercise professionals, and utilizing government resources when those are available. We've started a Global Connect newsletter and some webinars for our National Center leaders. And every year at the national meeting, or at the annual ACSM meeting, we host a National Center meeting where the coordinators from each of the national centers get together and share stories, learn what's happening, and are just able to do what happens when you get people together that have similar passion and are attacking a problem from different directions, to really get some good ideas going and learn what's happening in other countries. And then just one success for this last year was in Europe. They had the 7th annual European EIM Congress. It was held in Poland, and 2 amazing women came together and from nothing got that conference going with 650 attendees. They had dignitaries from these groups that are on the slide: Polish Olympic Committee, the Ministry of Health, several Polish universities, and immediately after the World Congress, they instituted a countrywide walking day to encourage people to get out and be physically active. So we're very excited about what she did, and this next year that Congress is going to be in Amsterdam. And then the EIM on Campus program. So we currently have 221 campuses that are registered. And in 2018, we had 44 new schools. That was, we were very excited about that. And in addition, we had 43 gold campuses, and these campuses are activating EIM at currently at the highest level, which means that they have started working with their student health services to make sure that that physical activity assessment and promotion and referral is starting to be integrated there. So we're very excited about that increase. And then many of you who are on college campuses may have seen the 2018 Mascot Challenge. This is such a fun activity. This is the 2nd year we've done that Mascot Challenge, and the winners, based on a panel of judges from the EIM on Campus Committee and the EIM Advisory Committee, awarded South Dakota State University #1, Iowa State University 2, and Jacksonville University 3. And there was a prize, a monetary prize for the winner of that. And then we always have a fan favorite and let everyone from every school visit or vote, have a vote. So Shenandoah University won that, followed by Westchester University of Pennsylvania, and Iowa State University came third. Now this year, those of you who are in a campus setting may have noticed that we had a new renewal and recognition process. Shelby, are you on the line? Do you want to talk about that?
Yeah, I'm here. That's fine.
Okay, great. Yeah, Shelby is, for those of you actually who have not met Shelby, Shelby Mandla is our new EIM program manager here in Indianapolis. And we're thrilled to have her, and one of her responsibilities is liaison, staff liaison with the EIM on Campus Committee and facilitating the EIM on Campus program. And she was integral to this new process, so I'm going to let her share that with you.
Thanks, Robyn. So yeah, so there have been a few changes with the on-campus recognition and renewal process. You can go ahead and put the content on the slide, please. So this year, as previous years, registered schools have had to renew their campus every other year, and this year the EIM on Campus Committee, for the ease of the schools participating, decided to combine the renewal and recognition online process. So it's now one combined application, so that means that schools are now asked to renew every year, and that's just because the leadership at universities and colleges change so frequently that we weren't wanting to lose contact information and for those news and updates that we send out. And so we just wanted to get everybody on the same cadence. And so that renewal and recognition process are in January and February of every year. And it's one application. However, the renewal portion is the first part of the application, and that is mandatory or required going forward. But the recognition portion is optional, but very encouraged. So we have had growth this last year. Last year we had 88 schools apply for recognition, and this year we had 139 receive recognition. So we were really excited to see that hopefully this newer application was easier for people to use and become recognized. Also, something that we did this year was we requested documentation to show the activities and accomplishments that schools did in 2018. So recognition is always based on the previous year's efforts and activities for their EIM group. And so we just asked for screenshots or pictures. We got a lot of fun pictures and videos of EIM that's happening in universities and campuses all over the world, really. We had some global schools even apply for recognition. One thing that did not change and that is separate from renewal and recognition is the registration. So if you're sitting out there and you're thinking that this might be something that would be good to implement on your campus, you don't have to wait till January and February. This is something that any campus can register for at any time, and the registration is located on our website. And so we would just encourage you to apply, or if you already have a program at your school, become involved with that program. And then something really exciting that happens every year at annual meeting is our recognition ceremony, and it's going to be on Wednesday, May 29th from 5:30 to 6:30, and it's going to be especially exciting this year because it's actually the 10-year anniversary of EIM on campus. It started in 2009, and so we're going to get to celebrate a little extra this year as it's the 10-year anniversary, and that's going to be in the pocket guides that you receive for the schedule at annual meeting. So you're welcome to attend that, and if you're getting recognized, I think the next picture shows, or the next slide shows, there it is, you'll get a chance to come up and be recognized by the EIM on Campus Committee Chair, get a group photo, and get your certificate at that annual meeting recognition program. So yeah, really excited for that. I think that's all the information I have for EIM on campus. At this time, we're going to open it up for questions, and we've actually received one, so we can start with that one, and then we encourage you to submit any other additional questions you have, and we'll take the next 10 minutes to go through those. So, Robyn, do you want to put yourself back on the screen so we can see your lovely face?
Sure. Okay.
Okay, awesome. So the first question is from Marie. Thank you, Marie. The question is, do we have ICD-10 codes for clinical exercise physiologists to bill? And has CMS approved this billing? And what will exercise physiologists have to include in their evaluation and allowed time for visit?
Yeah, unfortunately, we have not made a lot of progress for exercise physiologists. That's, again, when I mentioned reimbursement and policy, that's one of the areas that requires a lot of work. The codes, the ICD-9 codes and the CPT codes that are on the EIM online, on the EIM website are for healthcare providers. They're not for clinical exercise physiologists or exercise physiologists. So currently, if you are a clinical exercise physiologist or an exercise physiologist and you want to be part of the healthcare system, you might have to be part of a population health intervention where the program is being covered. It's a benefit either by maybe it's an employee population health program offered to employees of the hospital. And so they're willing to pay for that, and so you'd be paid to deliver the program, but you wouldn't be reimbursed as a provider. So I'm disappointed to not be able to give you better advice on that. Shelby and I just came from the EIM Summit, and there are some opportunities for exercise professionals to get involved with the diabetes prevention program. Again, you don't get reimbursed individually for that program, but the program can get reimbursed. But if you have an NPI and you have attend the lifestyle coaches training, exercise professionals really are ideally suited to be working with individuals with prediabetes. So again, it's not a typical reimbursement, one-on-one patient reimbursement situation, but we hope to do more work in that area in the future. So thank you so much for that question. We've been working on that for decades, frankly. It's been a slog.
That's great. We have a credential question from Lucy, and she says she and her coworkers all have the CCRP from AACVPR and would get the EIM3 credential. And as she understands it, she wouldn't be able to go through the exemption route, but they'd like to complete the course and take the test to attain the level 3 credential, and is asking if that's possible.
Yeah, so the level 3 credential is not associated with the course. You have to meet the educational and certification requirements. It was my understanding that is handled actually in our certification department. It was my understanding that the AACVPR certification was an acceptable one, but they have been in charge of that program up to now. When we change it, then those things will change. What I would say to that is, if you have a question about that, my email I thought was on the screen, but if not, we can get my email address to you and email me, and I'll follow up with that with you. Actually, I'm glad you asked me about the EIM credential, because with the new learning management system and with where we're going with ACSM and certification programs, EIM really is not it's not an accredited NCCA accredited or ISO accredited certification. It's been called a certification, but it's really an educational certificate program, an opportunity for professional development by individuals that do have some kind of fitness certification and education, meet those requirements, and either have already qualified because of their education and a clinical certification, or take the course or qualify for an exemption. In any event, sometime in April, by the end of April, we're going to be making a change to the test that's required to obtain the EIM credential, and that is basically we'll be pulling that test out of the Pearson VUE Testing Center, and it will be online. So if you take the course online and you pass the larger exam at the end of the online course, then that is the qualifying exam that you need to pass in order to get the credential. And typically the online course and exam is associated with levels 1 and 2 currently. It's not part of the level 3. So whoever asked that question, I'm happy to chat with you about that level 3, but it will be changing, and I don't think, and your concerns may be allayed there, so reach out to me offline.
Great. We have a few more questions here. Is there a resource to find EIM professional or credentialed people local to this person, or just anybody local who has been successful connecting with healthcare providers?
Yeah, so again, sort of that connecting piece has been something that we've had a lot of discussion about. ACSM was involved with U.S. reps, which represents a NCCA accredited professionals, and they have a database online where you can look someone up, but you can't contact them currently. You can put in your zip code, and you can find exercise professionals not only by ACSM, but also with the other NCCA accredited certifications, ACE and NSCA, that kind of thing. But there's some talk about turning that into a database that can be searchable, and someone could be connected. And exercises medicine has been, people with the exercises medicine credential, we've been having some discussions about how we could integrate that into that tool. So that's in progress. Secondly, we're actually going to be doing a pilot project here at ACSM with a company that's developed an application. It's kind of like Uber for fitness professionals. And it's a way to connect a provider or a health plan or employer to allow them to have their members or subscribers or patients connect with an exercise professional who has become part of the database and meets certain requirements, have them connect with that person directly. So we're going to do a pilot project on that and see how it works, and if it's successful, then we hope to invite, in fact, we may be sending out an invitation to ACSM certified professionals who might be interested in being part of that pilot project. And as part of that app, you can arrange to do in-person fitness coaching, or you can also do telecoaching, basically, where even if someone doesn't live in your geographic area, with video and, phone and whatever, that if you felt comfortable, you could guide someone remotely. So we're working on those two things, but that's been a real difficult thing, and that's why the EIM solution was created, because in a given community, we have found that if a healthcare system looks around and champions in both the healthcare system as well as on the fitness facility side, get together and say, we feel it's of mutual benefit to have a place that's safe and convenient for our patients. And the fitness facility says, I'm willing and able to take these folks in and provide them with the kind of training they need. And so to sign a partnership so that they'll work together and to develop a systematic referral pathway, it's harder to do now because the incentives on the healthcare side are not there unless they've moved into a population health model of care. But that seems to have been successful in the communities where they've gotten the right people in the right places in those healthcare systems and fitness facilities.
Awesome. Okay, several more questions, so we'll try to get through these here. Are there any objections, Terry's asking, to submitting an EIM presentation or poster at the annual meeting or other healthcare professional meetings, for example, the Academy of Managed Care Pharmacists?
Yeah, so we're all about exercises medicine getting out there. If you're going to call it exercises medicine, then it has to be, that is a trademark name. So you can't just put exercises medicine on anything unless it truly has something to do with the materials and the guidelines we've created here at the EIM Global Center. But if you touch base with us and tell us what you're doing, and if what it is represents EIM in terms of integration into a healthcare system and reaching out into the community and providing evidence-based resources, then that would be great. It could be So it wouldn't, it's not branded EIM, but it's really part of that whole EIM effort to accomplish the vision that Katie mentioned in the beginning. So I would just encourage you to reach out to us, and if it's a like intervention, then that might be something that we can talk about.
Okay. Victor asks, is there any or are there plans to create resources for individuals with physical disabilities to help guide them towards physical activity as continued rehabilitation, similar to the Inclusive Fitness Trainer Manual?
Yeah, no, so that's, you know, development of expanded resources are not in the province here of EIM, but rather in the education department at EIM or at ACSM. So larger, more robust training materials would come out of either education or publications. So there are a number of projects that are being developed. And as you mentioned, the Inclusive Fitness Trainer, there's some discussion about updating that and resources associated with that. We do have, just in terms of the patient handouts we're creating, we are creating a patient handout for individuals with mobility challenges, and that's been worked on by physiatrists and physical therapists that work in that space. So again, it's not the end-all be-all, but something that you could give to a patient to be positive and give them suggestions about where resources, more comprehensive resources that they could go to for help in their community or nationally, as well as some basic guidelines on how they can get moving.
Great. There's a couple other questions, but I've jotted them down, and I'll reach out to you specifically or individually with those answers. So just for the sake of time, I just want to close this with a thank you to Katie and Robyn and Colleen and Chad for kind of being the liaison for the ambassador program. So if there isn't anything else from you, Robyn, then I'm going to close out this webinar.
Well, just to thank all of you for your interest in EIM and for any promotion that you do. You understand the vision, you know what we're about, and there are many different ways to make it happen. And look for opportunities to be involved with EIM. You know, in the next coming years, we'll be going out with some different requests. And you know, if you're interested in being on an EIM committee, there, you know, you can go online and go through that application process. And I'm always looking for subject matter experts that can contribute to the projects that we're working on, because that's the strength of this college, is all of the expertise and passion we have here to really advance this initiative. So thank you so much for joining us.
Thank you.